Hey guys, welcome. I'm Ellie. I'm the president of Amnesty International at OSU.
And I'm Gary. I'm the vice president.
And welcome to our presentation today. Thanks so much for tuning in. Today we're going to be talking about COVID-19 and how we're going to be taking action on COVID-19 from home. So basically we have a few objectives for today. We're going to start by talking about organizing during a pandemic and what this is going to look like from us taking action from home, whereas instead of our weekly meetings. And then next, we're going to talk about human rights violations in relation to COVID-19. So we're going to talk about discrimination, xenophobia, gun violence, immigration, access to health services, and also censorship. So what is it going to look like when we're organizing during these difficult times? So there's three things that we want to remember. So first is self-care comes first, of course. You need to prioritize your well-being. And not only that, but also just making sure that you're staying safe during these times. And the next piece is community care. So checking in with other activists and practicing mutual aid and mutual support. And this can look like a text, an email, getting on weekly calls with fellow activists, but really just checking in on each other and making sure that we're all able to take action and that we're all supported during these times. So then the last piece that we're going to keep in mind is being creative. So obviously we're going to have to be connecting outside of in person. So we need to find alternative ways to meet and take action. So we're going to look at how we can use platforms like YouTube, Instagram to create short videos for public education and to ask people to take action virtually. So using social media platforms will also be helpful. Facebook, Twitter, Instagram to promote our work and amplify our actions. So basically just reviewing all the ways we can create a virtual space for our cohort. And now we've talked about how we as activists are going to kind of redirect our actions during this time. Now we're going to talk about how COVID-19 itself is affecting human rights, both in the United States and abroad. So during this time, these difficult times, it's very easy to, we're all experiencing a lot of like mongering of fear and hate in the media. So what's really important is to remember that we're gonna move forward, basically light the candle and move forward with empathy and kindness during this time, and just remember to stay united during this time, even though we're not able to be in the same room. So basically, we're going to just dive right in and talk about the different human rights issues and how they're related to COVID. So Gary?
Yeah, so I'm going to start off by talking about discrimination and xenophobia, specifically within the United States and how that revolves around COVID-19. So unfortunately, there has been a rise in hate crimes and xenophobia against people of Chinese and Asian descent in the United States. As a result of coronavirus. There have been increased cases of harassment, vandalism against Asian American businesses, and assault as a result of this xenophobia. There are several reasons for this spike, but an unfortunate factor is the government and media's role in reporting the crises. There are several instances where the media and the government have opened up for the possibility of xenophobic discrimination. For example, newspapers have used pictures of Asian Americans as the face of the virus, and many of you are aware of the Trump administration's use of the name China virus instead of using coronavirus or COVID-19. Government and media have a responsibility to discourage this kind of racist behavior in the United States. And when they report on the virus in the ways that I just mentioned above, open doors for dangerous and xenophobic interpretations, and unfortunately have real-world consequences in the form of hate crime and xenophobia. Next, we're going to cover how gun violence is affected by COVID-19. So COVID-19 has many people rushing to buy firearms to protect themselves, especially first-time buyers. Spikes have been seen, especially in online. Most on online purchases. One website, ammo.com, for example, has seen an increase in sales of over 68% in just the last month alone. Additionally, the crisis has caused many state governments to close all non-essential services, and thus training programs are canceled, and safety and training requirements for purchasing a firearm are often being waived in many states. So as a result of the combination of these two factors, more people are buying guns without proper training and without the proper background checks. And additionally, this affects several populations. Gun violence and COVID-19 affect certain populations more than others. There are certain at-risk populations that are spending more time at home, including children who can more easily gain access to their parents' firearms with the more time that they're home. Abuse victims, which may be spending more time, may have to be isolated with their abusers. And unfortunately, the populations that are at risk of suicide are more at risk because of more time at home, the isolation, and the greater access and easier access of guns. Groups such as these are already disproportionately affected by gun violence, but compounded with the fact that guns are becoming more widely available during this crisis and the increased isolation in American households will unfortunately see more violence because of the relaxing of gun regulations in the United States.
So next we're going to be talking about immigration. This is one of my favorite issues to talk about in terms of COVID-19 because it's not exactly one of the first human rights issues you think of when you think of the global pandemic and how it's affecting people's rights. So just a quick review. The United States has just confirmed that we have the most cases in the world of COVID-19. And just as a quick reminder, we also have the largest immigration detention in the entire world of over 40,000 people. So that being said, the United States is not taking the steps necessary to provide sanitation and what is needed for social distancing cues for the vulnerable detainees in immigration detention. So this is already a population that was extremely marginalized before. Like there's literally articles of people not having room to sit down, like they're standing on toilets in the immigration detentions just to have room to stand. And now we're facing this global pandemic, and one of our most vulnerable populations, we're not even enforcing social distancing rules. And so this is only going to serve to be a threat to everyone's public health, not just the immigrants who we're trying to marginalize. So basically, the quote that you see on the screen, ICE's unnecessary detention of tens of thousands of people poses a massive threat to public health. Detaining anyone solely for migration-related reasons during a global pandemic is cruel, reckless, and deadly. Yeah, guys, the United States has continued to detain immigrants, even though, even ones who are showing symptoms and they're being told not to, and they still are. So, yeah, the next slide that you see, just talking about how ICE is not really providing soap or hand sanitizer or introducing the social distancing rules that the CDC has recommended. And ICE has concealed and understated the number of detainees who have been exposed or contracted COVID-19. And we're going to touch on this later on in the presentation, and just the idea of information sharing and how important that is in combating the human rights abuses that come with the pandemic. And then finally, just Amnesty's recommendations to the US government. Just basically, ICE has the obligation to grant humanitarian parole to immigrant detainees who have COVID-19 or at extreme risk of contracting it. Right now, we see in the United States prison system, people are being taken out of the prisons to prevent the spread of this disease not being put in. So the fact that the United States is still arresting people with symptoms and not helping the people in detention to get the sanitation they need to survive. There's just a grave human rights violations happening in immigration detention in the United States. And it's not the first thing you would think of when you think of COVID-19 human rights. So I think this is an important part of what we're going to be taking action on in the upcoming months. Mm-hmm. So basically, Amnesty International, just to recap, is calling on ICE to urgently provide alternatives to detention, such as humanitarian parole, and except for in cases of extreme prolonged detention. And Amnesty is urging the United States governors and local authorities to utilize their authority to instruct immigration detention facilities to decrease their detainee occupancy. So that was immigration. So now we're going to talk about access to health services and how this has been affected by COVID-19. So first we have the piece in China where the virus originated from. So the Wuhan medical system is overwhelmed and many patients are being turned away from human rights and just basic treatment. And this is also a common theme that we're seeing in the United States, just a lack of preparation and supplies for people who are victims of the virus. And then more domestically again, in the United States, there's a crisis because states are denying abortions because they're deemed non-essential services during this time. So basically you can take action on this piece if you go to your Amnesty email. In our Action Alley, we have a petition on this piece urging our state representatives to basically provide these, what we know are essential services during this time. So that's access to health services. And now Gary's going to talk to us a little bit about COVID-19 and how the U.S. prison system has been affected by this.
Yeah, I'm going to talk about the U.S. prison system and how it has been affected by COVID-19. And there are some very similar effects as in immigration and the ICE detention centers. So under normal circumstances, the U.S. prison system, or U.S. inmates are already a population that have increased susceptibility to serious health concerns. For one, the U.S. has a staggeringly high prison population of 2.2 million. And inmates, as a result, inmates must live in overcrowded conditions with often poor ventilation. Additionally, prisons have been reported to have inadequate healthcare measures, and this is even considered in normal health circumstances. Now, these issues become even more serious under the coronavirus crisis that we are living under right now. The close living conditions and inadequate healthcare provisions have made prison inmates especially susceptible to coronavirus. And unfortunately, yes, there have been cases of inmates being released for humanitarian parole. However, the U.S. has not put out many long-term plans as of yet to deal with COVID-19 in the U.S. prison system. So next, Ellie is going to cover censorship.
Yes, so this is an important piece for human rights in terms of COVID-19 because this is a piece that is relevant to plenty of heads of states. We're not even going to go ahead and single out any because I think that pretty much every head of state is guilty of not being the most reliant when it comes to information sharing and being most accountable when it comes to sharing information not only between heads of state but also between heads of state and their people. So basically, we just want to make sure that this information sharing is happening and correct information is being shared so we can correctly combat the virus. And also just calling upon heads of state to promote freely reporting by the media, because that's another issue is we know that in past months there have been cases of China expelling foreigner journalists who are trying to document the human rights abuses. So, and this is across the board, every country is guilty of not being completely transparent and working together at the full level that is needed, the cooperation that is needed to really fight the pandemic. So that's the censorship piece. So I think that's all we have today for the human rights issues and how they are being affected by COVID-19. So thank you guys so much for tuning in today and taking the time to review this presentation, even though we're not in person. We really miss you guys' faces, but we really hope you're able to tune in every Monday to listen to our presentation and then take action and just pay attention to our Action Alley and see how you can take action from home, because even though we're all at home and distance, we're all still together working on these issues. So thank you guys so much for taking the time today.
Thank you guys so much. And once again, next Monday, we are going to try to have more of a live session where you guys can comment on our presentation. We can have more of a Q&A and some more integration of what you guys think and how we can act on some of these issues. All right, but thank you guys.
Bye, thanks.